I'm Amy Halverson. I'm an attending surgeon at Northwestern Memorial Hospital, and I'm an associate professor of surgery with the Feinberg School of Medicine at Northwestern University. I'm a colon and rectal surgeon, so I treat a wide variety of individuals with problems related to the colon, rectum, and anus. I don't do surgery on the stomach. I don't do surgery on the gallbladder. I focus my surgery to diseases of the colon and rectum. I have a primary interest in individuals with colon and rectal cancer and anal cancer. When I'm caring for patients, I think that one of the things that they are looking for is quality. They want to know that they've got a technically competent surgeon that is up to date on the latest treatment recommendations. I also think that compassion is important. It's one thing to just treat a disease, but it's another thing to take care of the individual. I think one of the top priorities for caring for an individual is having good communication. It's important to have good communication with the patients so that they understand what the treatment plan is and what the expectations are. Patients often ask, what is normal or what isn't normal? And I think it's important to explain that to patients and also welcome that communication so that the patients feel free to ask questions before surgery, during their hospitalization, and after they go home. Every morning after surgery, I like to meet with the patients and explain to them their care plan for the day so they know what to expect and they can recognize if something deviates from that plan. In my work, especially working in areas of the colon and rectum, it's important to be compassionate, and I also feel that I have a special ability to put my patients at ease. And that requires a lot of compassion and a bit of a sense of humor. One of the questions that most patients want to ask me, and sometimes they do, and I think sometimes they just want to ask me, is how did I get involved in this kind of profession? And I feel that a lot of the problems that people experience, problems with not having good control of their bowels or symptoms of pain or bleeding around this area, they can be very frightening. Patients are reluctant to talk about these problems, and it's so embarrassing to come in to see a colon and rectal specialist and have these problems addressed. And so I feel that over the years I've developed a special skill at putting my patients at ease and making them comfortable through the examination and discussing the treatment options for their problem.